Hypercapnia. Hyper.
Okay.
Okay. So this is a result of hypoventilation. When you hypoventilate, okay, hypoventilation is going to cause a buildup of CO2 because you're not exhaling, you're not getting rid of it. And that increase in CO2 is going to drive our equation left to right, producing hydrogen ions. You know that there's a direct relationship between hydrogen ion concentration and pH. As hydrogen ions go up, pH falls. And then we call that an acidosis. It's a respiratory acidosis because it's being triggered by a decrease in ventilation. We'll go over this a little bit more next class, but I'm going to show you one more thing. Let's suppose, though, a lot of times if you work in emergency room, you'll have young people, teenagers, maybe high schoolers come in with chest pain. More often girls than boys. That's just the way it is. I'm not trying to be chauvinistic. And they're complaining that they're not only having chest pain, but they feel short of breath. They're tachycardic. There's a feeling of impending death. Okay? And of course the mother is right there with them. They're usually besties. Okay? And you do blood gases, and you find out they have a respiratory alkalosis. What does that mean? Well, they come in hyperventilating. They're having a panic attack. Okay? And as a result, they're hyperventilating and they're getting rid of CO2 at an excessive rate. Okay, so that's driving down their CO2 so that in the blood it's less than 35. Okay, the PaCO2. We call that condition hypocapnia. Okay, so there's a loss of substrate on this side of this equation. By Le Chatelier's principle, that's going to drive this equation right to left. Basic principle of chemistry. Okay? In other words, you can think of these reactants or substrates reacting in an effort to replace that which is being lost to maintain equilibrium. Okay? So, if you're using up free hydrogen to react with bicarb to replace the CO2 that's being lost, the hydrogen ion concentration within the blood falls. Okay? Therefore, the pH in the blood climbs. That's called an alkalosis. If the alkalosis is being triggered by a loss of CO2 by hyperventilation, we call this a respiratory alkalosis. Okay? So a respiratory alkalosis is generally triggered by hyperventilation, whereas a respiratory acidosis would be triggered by hypoventilation. Y'all able to follow all that? We're going to go over it again next class. I'll tell you this is, if you can, read the section in your book on gases, okay, and acid-base disturbances. Next class is a lot of physiology, which is more difficult than anatomy.
Dr. Penner, I found the name of the movie. It's called The Perfect Husband.
The perfect, wait, you see, it wasn't all bad. They referred to him as the perfect husband.
Yeah. It's ironic.
Okay, so read about blood gases because the next class is going to be a little bit more difficult.
Yeah.